You know what I find interesting about men? They'll go to the mechanic the moment their car makes an unfamiliar sound. They'll call a plumber the second a pipe starts dripping. But when something changes in their own body, something personal, something that happens quietly in the bathroom every morning, they wait. They hope it'll sort itself out. They don't mention it to anyone. Hello, I'm Dr. Fernanda Oliveira, board certified urologist, and on this channel, I speak plainly about the things that matter most to men over 50: your health, your strength, your quality of life. And today, I want to talk about something that a surprising number of my patients bring up only after months of dealing with it silently: the stream. If you've noticed that your urinary flow isn't what it used to be, if there's hesitation before it starts, if the pressure feels weaker, if you're waking up once or twice or 3 times a night to use the bathroom, I want you to know something before we go any further. This is not unusual. This is not shameful. And this is not something you simply have to accept as the new normal. Millions of men over 50 are experiencing exactly this right now, and most of them have never once talked about it openly with anyone. Not their doctor, not their partner, not their closest friend. So the fact that you're here, listening, willing to learn, that already tells me something good about you. Now, most men who notice these changes assume it's entirely a prostate issue, and the prostate is certainly part of the conversation. But here's what surprises almost every patient I explain this to. The prostate is only part of the story, and the part that most men can actually do something about, starting tomorrow morning, has nothing to do with medication or procedures. It has to do with muscles. Specific muscles that the vast majority of men have never once trained in their entire lives. Let me explain what's actually happening inside your body, because I think once you understand it, everything else I'm going to share today will make much more sense. As men age, the prostate, a small gland that sits just below the bladder, has a natural tendency to enlarge. This is incredibly common. It has a medical name: benign prostatic hyperplasia. But the important thing isn't the name, it's the geometry. Picture a small donut surrounding a straw. The straw is your urethra, the channel that carries urine out of your body. The donut is your prostate. When that donut is small and soft, the straw stays wide open and flow is easy and strong. But when the donut begins to thicken, even just a little, it presses inward on that straw. And suddenly, the flow changes. It weakens. It hesitates. It requires more effort to get started. That's what many men over 50 are feeling. And yes, the prostate plays a role in that. But here's what I want you to sit with for a moment, because this is where the conversation gets genuinely interesting. Surrounding the prostate, the bladder, and the entire lower pelvic region is a group of muscles that most men have never given a single thought to. They're called the pelvic floor muscles. And I want you to imagine them as a small internal hammock, a network of muscle and connective tissue that stretches across the base of your pelvis, supporting your bladder, your bowel, and yes, your prostate from below. When that hammock is strong and responsive, it actively supports the structures above it. It helps maintain urinary control. It contributes to the pressure and strength of your stream, and it plays a meaningful role in intimate function as well. But when those muscles are weak, and in most men over 50 who've never specifically trained them, they are significantly weaker than they should be, that support disappears. The bladder loses some of its structural backing. The control mechanism becomes less precise, and the urinary symptoms that men quietly chalk up to just getting older begin to appear and gradually worsen. One of my patients, a gentleman in his early 60s, sat across from me frustrated after years of interrupted sleep and weak flow. He'd tried adjusting his diet, he'd cut back on coffee, he'd done everything the internet told him to do, and things had improved only marginally. When I explained to him that his pelvic floor was almost certainly significantly undertrained, and that a few minutes of targeted exercise each morning could meaningfully change the situation, he looked at me like I'd just told him something slightly unbelievable. 6 weeks later, he came back. He was sleeping through the night. His stream had strengthened noticeably. He felt, in his words, more in control of his own body than he had in years. That is not an unusual outcome. I see versions of that story regularly. And I want you to understand why it happens, because the mechanism is actually quite elegant. These pelvic muscles respond to training the same way any other muscle in your body does. When you consistently challenge them, when you contract them, strengthen them, teach them to activate on demand, they become more capable. They provide better support to the surrounding structures. They improve the precision of bladder control. And crucially, the act of contracting and releasing these muscles regularly also stimulates circulation in the entire pelvic region. Blood flow increases. Oxygen and nutrients are delivered more efficiently to the prostate tissue itself. And that improved circulation over time supports the health of the gland as well as the function of the surrounding anatomy. There's also something worth understanding about timing. The morning, specifically, turns out to be an unusually good window for this kind of training. When you first wake up, your body has just completed its overnight recovery cycle. Circulation is increasing. Muscles that were relaxed during sleep are becoming responsive again. The nervous system is transitioning back into its active state. Training the pelvic floor during this window is like warming up an engine before you drive. Everything engages more smoothly, the muscles respond more readily, and the habit builds faster because you're anchoring it to something you already do every single day without thinking. You wake up, you move through your morning, you do 5 minutes of this routine, and then you get on with your day. 5 minutes. That's genuinely all it takes, done consistently. Now, I want to make sure I mention this clearly because I always do. What I'm sharing with you today is educational information, and it's offered with genuine care and clinical experience behind it. But it is not a substitute for a proper medical evaluation. If you are experiencing pain, significant difficulty urinating, blood in your urine, or any symptoms that feel serious, please see a urologist directly. Don't rely on YouTube. Get examined. These exercises are wonderful for the vast majority of men dealing with age-related changes, but they are not a replacement for diagnosis. For everyone else, for the men nodding along right now, recognizing themselves in what I've described, keep listening. Because what I'm about to show you is something you can begin tomorrow morning, requires no equipment, no gym membership, and no medication. Just your own body and about 5 minutes of your time. But before I walk you through the 3 exercises, I need to show you what happens inside the body when these muscles are properly trained. Because understanding the why is what turns a casual attempt into a genuine habit. And there are also a couple of mistakes that men almost always make when they first start doing this. Mistakes that quietly prevent the exercises from working the way they should. That's exactly where we're going next. All right. Let's get into the part you've been waiting for, because everything we've talked about so far, the anatomy, the pelvic floor, the circulation, the morning window, it all comes together right here in 3 simple exercises that I genuinely believe can change the way you feel every single morning. But I want to start with the mistake, because I've watched too many men begin this kind of routine with the right intentions and the wrong approach, and then give up after 2 weeks because they didn't see results. Not because the exercises don't work, but because of one very specific error that undermines everything. The mistake is this. Most men, when they first hear about pelvic floor exercises, either ignore them entirely because they sound too simple to matter, or they do them incorrectly without realizing it. And the incorrect version is surprisingly common. Men tighten the wrong muscles. They hold their breath, they clench their abdomen or their glutes instead of isolating the actual pelvic floor. And when you do that, you're not training the right system. You're just creating tension in the wrong places and wondering why nothing is changing. So before we talk about any of the exercises, I want you to do one thing. Right now, wherever you're sitting or standing, I want you to imagine that you are trying to stop the flow of urine midstream. The muscles you just engaged, that internal lifting, squeezing sensation deep in your pelvis, those are your pelvic floor muscles. Not your stomach, not your backside, that deep internal contraction. That's exactly what we're working with. Keep that sensation in your body awareness because you'll need it in just a moment. Now, the first exercise is the foundation of everything else, and it has a name you may have heard before, though perhaps never thought applied to you. It's the Kegel. And I want to gently but firmly remove any awkwardness around that word right now, because in my clinic, Kegels are as routine a recommendation as telling someone to take a daily walk. They are not a women's exercise. They are a pelvic floor exercise, and the pelvic floor does not have a gender. Here is how you do this correctly. Contract those deep pelvic muscles, the same ones you just identified, and hold that contraction for 5 seconds. Not a white knuckle grip, just a firm, focused squeeze. Then release completely for 5 seconds. Let everything relax fully. That full relaxation is just as important as the contraction because the muscle needs to learn both states, activation and release, to function well. Then contract again. Hold for 5, release for 5. You're going to do that 10 times, and that is one set. 3 sets each morning. And here is the beautiful thing about this exercise. You can do it while you're brushing your teeth, while you're waiting for the coffee to brew. Nobody around you will have any idea what you're doing. It requires no equipment, no floor space, no special clothing, just intention and consistency. Within a few weeks of doing this daily, the muscle begins to respond. It becomes more precise, more capable of holding when it needs to hold and releasing when it needs to release. Men report fewer sudden urges. They report less hesitation at the start of flow, and many report that the stream itself becomes noticeably stronger. Not overnight, but steadily, reliably, over the course of a few weeks. The second exercise works beautifully alongside the Kegel because it approaches the same region from a different angle. It's called the pelvic bridge, and if you've ever done any kind of yoga or physical therapy, you may recognize it. You're going to lie on your back on a comfortable surface, a yoga mat, a folded blanket, whatever you have available. Bend your knees so your feet are flat on the floor, about hip width apart. Then slowly, you're going to press through your feet and lift your hips upward until your body forms a straight diagonal line from your knees to your shoulders. Hold that position for 5 seconds. Feel the activation in your glutes, your lower back, and, if you're focusing correctly, that same deep pelvic region we've been working with. Then lower yourself back down slowly with control. That's 1 repetition. You're going to do 10 to 12 of those. What the bridge does that the Kegel alone cannot do is activate the surrounding musculature, the glutes, the hip stabilizers, the lower back, while simultaneously stimulating circulation through the entire pelvic bowl. Remember what I said earlier about blood flow being critical to prostate health? This exercise is one of the most effective ways to drive fresh, oxygenated blood into that region every morning. Men who do this regularly often describe a feeling of warmth and looseness in the lower body afterward, and that warmth is real. It's increased circulation doing exactly what it's supposed to do. The third exercise is one that surprises people because it feels more like a general fitness movement than a targeted pelvic exercise. But the connection is direct, and once I explain it, it'll make complete sense. It's a slow, controlled squat. Stand with your feet roughly shoulder width apart, toes pointed slightly outward. Then lower yourself slowly, taking about 3 or 4 seconds to descend into a comfortable squat position, as low as feels stable and pain-free for you. Hold at the bottom for 10 seconds, then rise back up slowly. 8 to 10 repetitions, that's all. The squat engages the entire lower body kinetic chain, the quads, the hamstrings, the glutes, and in doing so, it creates significant pelvic floor activation and dramatically increases circulation to the lower pelvis and prostate region. It also helps with something that doesn't get discussed enough in this context, which is pelvic pressure management. When the muscles surrounding the pelvis are strong and coordinated, they manage intra-abdominal pressure more effectively. And better pressure management means less unnecessary strain on the bladder and the urinary channel during daily activities. So here is what the complete morning routine looks like when you put it all together. 3 sets of Kegel contractions, 10 repetitions each, 5 seconds on, 5 seconds off. 12 pelvic bridges, slow and controlled, holding for 5 seconds at the top, and 10 slow squats, holding for 10 seconds at the bottom. From start to finish, you are looking at 5 minutes, maybe 6 or 7 if you move slowly and deliberately, which I actually encourage. This is not a workout to rush through. This is a practice, intentional, focused, and done with awareness of what you're training and why. Now, I want to talk about one more thing before we finish today, because exercise alone, as powerful as it is, works even better when paired with one simple daily habit that most men are unknowingly getting wrong. And it involves something as basic as water. Hydration matters enormously for urinary and prostate health, and the timing of it matters just as much as the amount. Most men either drink too little throughout the day and then compensate in the evening, which almost guarantees multiple nighttime bathroom trips, or they drink adequate amounts but don't think at all about when. My recommendation is simple. Drink the majority of your fluids during the morning and afternoon. Taper off significantly after dinner, and aim to stop drinking large amounts of fluid at least 2 hours before bedtime. This one adjustment alone, just the timing, not even the total quantity, has helped many of my patients reduce their nighttime bathroom visits noticeably within just a week or two. Combined with your morning exercise routine, you are now supporting the pelvic floor from two directions simultaneously, strengthening the muscles that control flow and removing the unnecessary nighttime pressure that was disrupting your sleep. I want to tell you about something that happens in my practice that I find genuinely moving. Men come in carrying this issue like a weight they've been quietly dragging for a long time. And when you give them something concrete, something they can do themselves with their own body that costs nothing and takes 5 minutes, something shifts in them. Not just physically over the following weeks, but immediately, in that appointment. Because they realize this is not out of their hands. They are not passive passengers in what's happening to their body. They have agency. They have tools. And that realization alone changes how they carry themselves. That's what I want for you today. Not just the exercises, though the exercises genuinely work, but the understanding that your body is responsive. It is waiting for the right input, and you are fully capable of giving it that input starting tomorrow morning. Give this routine 4 weeks of genuine consistency, not perfection, consistency. If you miss a morning, you pick it up the next day without guilt. You track how your sleep changes. You notice whether the hesitation at the start of flow begins to reduce. You pay attention to how your body feels with more deliberate support in this region. The improvements tend to be gradual, but they are real, and they compound over time. And please, one final time, if you have symptoms that feel serious, if there is pain or blood or significant difficulty urinating, please do not wait. See a urologist. Get evaluated. What I've shared today is appropriate for the vast majority of men experiencing common age-related changes, but a proper clinical examination is always worth having. If you're going to start this routine tomorrow morning, go down to the comments right now and type the words "starting tomorrow," just that. Because that small act of commitment, saying it out loud, even in a comment, tells your own mind that you mean it. And it tells the other men watching this that they're not alone in taking this step. If this conversation was useful to you today, please subscribe to this channel. Every week, I bring you honest, practical, clinically grounded information to help men over 50 stay strong, stay healthy, and stay fully present in their lives. No fear, no shame, just real guidance from someone who genuinely wants to see you thrive. You showed up today. That matters. Now go show up tomorrow morning for 5 minutes and let your body show you what it's still capable of. I'll see you in the next one.